Okay, this video is about conventional medical research because there's a lot of people, including most doctors, nurses, and stuff, they think the conventional medical system is real and they don't realize that most of it is just nonsense. And I'm going to show you why modern medical research is mostly nonsense. I mean, we all know that lots of papers, they can't be reproduced, but I just want to give you a typical example. Like I watch a video. Here's this guy, Dr. Noon, okay? This guy right here, and he's giving some lecture related to kidney disease. First of all, he reveals his disclosures. Now, these are all the companies that are giving money, donating to support his work. AstraZeneca, Alexion, Bayer, Boehringer and Ingelheim, Cambridge Healthcare Research Group, Dedham Group, Cornerstone Medical Education Group, Medscape, American Diabetes Association, Renal Society of Australasia, okay, CSL Behring, and more. And what I'm saying is this is common. He's getting money from so many corporations. He has to make them happy. If he doesn't make them happy, they will immediately turn off the faucet and he gets no money. What I'm saying is, how could a guy with this many sponsor commitments be objective about what he's finding? Remember the pictures I showed you of Isaac Newton when he goes by himself to the family cottage in Woolsthorpe and he just sits around in his backyard doing experiments by himself with no money? Now, I realize sometimes you do need money for experiments, but a lot of times you don't. And what you most importantly need is a willingness to seek objective truth without any financial influence. Because even if you have just a little bit of bias, it often screws everything all up. And that's also why a lot of times poor people or people who have no financial gain, they produce the best work. Okay, but this is typical. And that's why, like I said too, there's not going to be any new technology that's going to improve anything. AI is a joke. It's going to just be written by the drug companies. It's going to say prescribe more drugs, okay? And like I've seen CAT scans, they get the new CAT scan machines and say, oh, isn't it wonderful? Now we can diagnose appendicitis and make the correct choice when we take the patient to the operating room. We don't have to do so many exploratory laparotomies. And yeah, that's true. But guess what? You get hardly any appendicitis operations in a month. In a big hospital, maybe you get 2 of them or something, versus how many lung cancer screening studies do they do with that CAT scanner every day? 20? 30? How many, cardiac CTs do they do with that scanner every day? 5? Okay, what I'm trying to say is it's going to go for the money, okay? There might be some fringe benefits. There certainly are quite often with high tech, but most of it will go for money or it wouldn't be purchased. All right, let me just show you the next slide in this little talk. The other thing you're going to hear is that nobody's got the time, nobody's got the money to study nutrition and things like the effect of, social support and religion and whatnot on health. There's been a little bit done in that, but not much. But anyways, I just want to show you, you always hear no one's got time or money for nutrition research. Now look at a typical drug study. Now this isn't even an interesting one. This is just some random BS drug study I just noticed when I was reading papers about the kidney physiology. So they've got time for some, boring, routine, stupid drug to study 17,000, that's 17,100 something patients for 4.2 years. What I'm trying to say is, whenever there's a chance to make money for a drug, all of a sudden $1 billion pops out of the woodwork and they've got the money for the study. When somebody talks about studying nutrition, stuff that actually works and makes a difference, like the very low protein diet for treatment of kidney failure and perhaps with analogs or essential amino acid supplements, it's very difficult to get money. It's very difficult to find the funding to do these studies and to do them correctly. Okay, the benefits of the vegan diet for, mild kidney failure, all right, moderate kidney failure. But if you're going to try to promote a drug, $1 billion, here you go. And I'm just telling you, this is how it is. And this is also why I say, until you go back to a Bible-based view of ethics, that man is created in the image of God and therefore he's important and part divine, and we will do right by him and we will not abuse them. This is never going to change. And there's no other way around it. Atheistic Darwinism medicine, it's a joke.